HIPAA compliance usually feels manageable, right up until the moment it becomes urgent. An audit notice arrives. A vendor asks for documentation. A security incident raises hard questions. And suddenly, your practice has to prove, not assume, that the right safeguards were in place before anything went wrong. When OCR sends an audit notice, practices may have to produce core documents fast, sometimes within 10 business days. That is where most teams get stuck. Not because they do not care, because compliance is rarely one thing. It is policies, risk assessments, staff training, vendor agreements, scans, incident logs, patient rights workflows, and evidence that all of it has been maintained over time. Miss one piece and the whole program starts to look fragile. Here is the simple idea. HIPAA is not a folder. It is a system. And a system only helps you if it is alive, current, and documented. Think of it like a clinic's emergency kit. It is not enough to own one. It has to be stocked, checked, and ready before the emergency happens. HIPAA Agent Concierge is built to do exactly that. It acts like an always-on compliance officer for healthcare practices. Instead of handing you a checklist and wishing you luck, it helps run the full program continuously. It starts by looking outward and inward. Each month, the platform scans your external security posture. Each quarter, it can assess internal network exposure too. That matters because HIPAA is not just about paperwork. It is also about showing that you are actively identifying risk, not waiting for a breach to identify it for you. Then it turns those findings into something auditors actually ask for. The most important document in many reviews is the Security Risk Assessment. HIPAA Agent guides that process through a structured interview, autofills much of the technical detail from scan data, and produces a signed, audit-ready report. So instead of staring at a blank document, your team starts with real evidence and clear gaps to fix. From there, the program fills in the rest of the compliance spine. It maintains your HIPAA policies. It documents privacy and security officer roles. It tracks annual reviews and version changes. It manages workforce training with modules, quizzes, and completion records for each employee. It keeps your business associate agreements organized, so every vendor touching protected health information can be tracked, renewed, and verified. It also helps with the moments practices hope never happen. If there is an incident, the system can log what happened, support the breach risk assessment, and help organize the corrective steps that follow. If a patient requests records or an accounting of disclosures, deadlines and documentation are easier to manage. In other words, the platform does not just prepare you for an audit. It prepares you for real operations. Imagine a 5-provider clinic that has grown fast. They use an EHR, a billing vendor, a cloud phone system, a scheduling tool, and a few AI assistants. Everyone assumes the practice is probably compliant. Probably. But the risk assessment is outdated. Training certificates are scattered. One vendor never signed a BAA. And nobody can say, with confidence, what evidence exists if OCR asks for it. Now compare that with the same clinic on HIPAA Agent Concierge. Scans run on schedule. The risk assessment is current. Policies are already on file. Training records are centralized. BAAs are tracked before they expire. Compliance actions are time-stamped and preserved in a tamper-evident audit trail. Key records can be cryptographically hashed and anchored, which is a simple way to prove they were not quietly changed later. And because the platform uses a zero PHI design, it does not pull patient data into yet another system just to manage compliance. So when the question comes, the answer is not a scramble. It is a package. That proof matters. In compliance, timing is everything. An unsigned policy created after an audit notice does not carry the same weight as one that has been maintained all year. A training log reconstructed from memory is not the same as a dated certificate. A risk assessment that exists only because a regulator asked for it is not the same as a living review process. HIPAA Agent is designed to close that gap between saying you are compliant and being able to demonstrate it. And if an audit does happen, there is a human behind the system. The response can be coordinated quickly, with documentation assembled fast, instead of forcing your team to build the plane while it is already in the air. That is the real shift here. Less panic, less manual chasing, more readiness. So the takeaway is simple. HIPAA compliance is not about collecting more paperwork. It is about building a clear, continuous chain of protection, training, accountability, and proof. HIPAA Agent Concierge turns that chain into a working system your practice can actually keep up with. When the stakes are high, that is what readiness looks like.